Hello, everyone. Welcome to Helpful Tips for Reducing Language Barriers Caused by Communication Disorders. I am Jessie. I am the Downtown Oakland Senior Center Director, and we have with us today Roberta Ellman, the president and founder of Aphasia Center of California. Roberta, welcome.
Thank you, Jessie.
All right, I'm going to stop sharing my screen so that way Dr. Roberta can share hers.
I'm thrilled to be here, and thanks for inviting me. And I'm going to go ahead and, like you say, share my screen. So give me a second here to get my presentation up and running. And as people are listening today, think of questions you might have or experiences you might have had with communication problems due to a language barrier. So that's what we're going to talk about today. So hopefully everyone can see my screen now. So I am a speech language pathologist by training, and my specialty area is aphasia. And we will talk quite a bit about aphasia as part of this presentation, but also other disorders that cause language barriers. So I have my name and the Aphasia Center, but there's some ways to keep in touch with us, or if you get interested in what I'm talking about or know someone with aphasia, we have a website and a Facebook page and also other social media like Instagram and Twitter. So feel free to contact us through those means, and let's get started. So that's our logo for the Aphasia Center of California. And actually the Downtown Oakland Senior Center has been very much a partner with the Aphasia Center of California for now 27 years. So we actually, when we started the organization, we started at the Downtown Oakland Senior Center. So we're helping rebuild communication and transform lives. And we'll talk more about aphasia because a lot of people have never heard of it. So don't be surprised if you're one of those. But first I want to start with communication and what is communication and what do I mean by it? So here's the dictionary definition. Communication is the act or process of using words, sounds, signs, or behaviors to express or exchange information or to express your ideas, thoughts, feelings, etc. to someone else. So basically, it's not just speaking like what I'm doing right now. Communication involves a lot of different, we would say, modalities or ways of communicating. And that'll be very important for the talk today, because sometimes when you can't get something across one way, or a person can't speak, for example, they may be able to convey their ideas or thoughts or feelings in another way. So communication also requires more than one person. So the audience right now, those of you who are listening, watching, you're my partner in this communication. So when someone speaks a language, we usually consider 4 main areas or abilities. And I'm going to repeat this maybe 3 or 4 or 5 times in the next 45 minutes. So here are the main things: speaking, what I'm doing right now. These are parts of communication or parts of language. Understanding or listening, that's what you're doing right now. And what neither one of us probably are doing would be reading, but that's a form of language. And writing would be another modality or way of communicating and form of language. So those are the main ways of communication. So let's keep that in mind. Here we have a little diagram, a little graphic that shows that communication takes 2 people. And it's a process by which 2 or more people actually, it's a process by which people send messages or exchange ideas or thoughts with one another in both a verbal, that would be speaking or writing, or nonverbal manner. So we can talk about some of those various nonverbal ways, facial expressions and gestures. I'm gesturing even though I'm speaking at the same time. It might be with a pad of paper and a pen. I could write something to someone. I could use other ways of communicating. So the important thing in this slide, and this as I'm talking, is that there's 2 people at least, and there's a message that I'm sending, and you as the receiver hopefully are understanding what I'm saying. And then it's like a chain. It goes back and forth if we're having a conversation. So here's some other graphics that kind of say the same thing. You have the 2 people and you have to have an exchange of information. And if we look over at this graphic, it shows that there's feedback as well. So sometimes our messages get across to one another without any problem at all. I say something, the person hears me, they understand me, they respond, I understand them, it keeps going. But lots of times, for all of us, we don't have to even have a communication disorder. Communication can break down. And so I may say something and maybe I didn't say it quite right, or there was noise or something going on and you didn't understand what I said. And then you say something back to me and all of a sudden the communication is impaired. We didn't communicate properly. So that's what the theme of this talk really is. What do we do in those situations? So we'll keep going, keep that in mind, that there's more to communication than just those 4 primary areas of language that I had mentioned, and I'll repeat them. Here's the second time: speaking, understanding and listening, reading and writing. We'll also consider other ways to communicate. And so you have to be a little bit creative sometimes, and you have to think out of the box. If someone's having a communication disorder or language disorder, how to best communicate with them. And I guess I would say that it isn't simple. It isn't always obvious. And even for a speech language pathologist, sometimes it takes time to figure out what works best in a given situation with a specific person. So it isn't, I don't have a formula or a cookbook recipe for you, but maybe to give you some ideas of things to try. All right, so let's talk about some communication challenges. A communication challenge can affect one or more of those areas of language that I just mentioned: the speaking, the understanding, the reading, and the writing. And how you attempt to communicate with this other person depends on what is causing the language barrier. So that's where we have to get sometimes a little creative. And today I'll be talking about those different language barriers that you may encounter just in normal life, right? And ways to work around those language barriers. What I want to say is that when someone has a language barrier, that doesn't mean that their intelligence is affected. So someone can be very, very smart. And let's use an example even of ourselves. We're all smart. We all have certain languages that we speak. We might speak one language. I'm speaking English right now. We might be bilingual or polylingual and speak other languages. But sometimes we travel, or even within our own community, let's say in Oakland. We go somewhere in Oakland and we encounter someone who speaks a different language. Well, that's a language barrier, right? If they don't speak, in my situation, if they don't speak English and maybe they're speaking another language, their native language might be Bulgarian, to use a maybe not a very common example. So they're still intelligent and I'm still intelligent, but all of a sudden we can't communicate well because we don't speak each other's languages. So that's another situation where some of these strategies can work. So for communication to occur, for good communication to occur, one person sends a message, and that could be speaking, it could be writing, it could be gesturing, it could be pointing to a photograph. It could be a lot of different ways, but I'm sending a message. In this case, I'm talking to you. You're receiving the message. If you're not sure, maybe you check and make sure, you verify. That's what I mean by verify. You check in. Roberta, did you mean this? Is this the right word? Is this what you're talking about? And then I reply to the message. That's kind of a chain. And then the next person sends the next message and we have a conversation. They receive the message, they might verify the message and reply to the message, and on it can go. Or maybe it just, someone asks me a simple question, I might say to Jessie, Jessie, did you receive the email that I sent yesterday? And she understands what I'm asking. It might be spoken and she says, yes, I did receive it. Thanks, Roberta. And I said, great, talk to you later. And so that's an exchange. It might not even go beyond that, but it may be something like, did you, were you able to get that information I asked about? And then she has to provide some information. So again, it could last for a few seconds, that exchange of information. It could last for minutes or longer. When you're sending a message, there's many different ways, and I've already said many of these. So we could speak, which is what I'm doing right now, and I'm speaking English, so it could be a different language. I could be writing, and texting has become so common now, right? So we see people with their cell phones and they're walking and they're texting at the same time. That's a way of sending a message. Gesturing, and people a lot of times will ask me, what about sign language? And sign language is a gestural language, so that's a way of communicating if someone is deaf or significantly hearing impaired or knows sign language as a second language. I could draw something to communicate. So maybe I don't have the words. I do that quite a bit. I find if I'm traveling in a country where I don't speak the language, sometimes I can draw a picture of what I'm wanting to communicate with that other person, and then they understand because they see it. An emoji, like we've gotten with our texting, we use little symbols, right, to convey information. Or I could show someone a photograph. And then there's old or even less used things like Morse code and other types of ways of communicating. So there's lots of ways of sending information. And if someone has a difficulty with one of these, let's say they have a speech disorder, it's possible that many of those others would be a viable, an effective way of communicating. Then, excuse me, we talk about receiving a message. Let me take a little bit of water here. So when one's receiving a message, that's talking about understanding and comprehending. So first you have to be able to hear the message. So we're going to talk about hearing loss in a minute, because that's such a common disorder that most of us have some amount of hearing loss as we get older. But it's more than hearing. You have to be able to hear it, but then you also have to be able to comprehend it. So that goes up higher into the higher areas of the brain for comprehension. You can also receive a message by seeing. If someone is showing you a picture or drawing or is gesturing, you need to be able visually to see. So if you have visual impairment, that could be complication. Reading, you could read what someone has written to you. If you're visually impaired, Braille is a way of receiving a message, right? Someone could have typed using a Braille typewriter, basically, sent you a message in Braille, and there are others. There are other ways of receiving a message. So again, there's various ways, and so keep those in mind as we go further. So the problem in communication is when there's a barrier. We're talking mainly about language barriers today, and this, I kind of grabbed this off the internet. These figures are showing what happens sometimes when there's a noisy environment. And I would say this would be one of the most common problems, one of the biggest reasons why people have trouble communicating, when there's noise. Noise is not your friend when you're trying to communicate for anyone. To try and speak over noise is very challenging, and for someone with a hearing loss or other reasons why they may have trouble comprehending, noise makes it only worse. So in this case, the sender, this person over here on my left here, he's saying, he's wearing a tie. I'm going to assume he may be a she, but it says, "Hi, Alfred, how is your sister?" But there's noise in the background. So maybe someone has a television set going, or maybe there are construction workers right outside with a jackhammer, and the other person, the receiver, says, "Oh, I'm fine, I went kayaking today." So obviously that person did not understand what the first person was asking because of the noise. The noise got in the way. It created a barrier. So, this person is asking about the sister, and this person is answering that they went kayaking. So we've had a communication breakdown in this example, right? And when this person will realize, uh-oh, something went wrong here. And if it was because of noise, then the solution is to find a less noisy environment. You have to stop the noise. And so let's say you're a receptionist at the desk at the downtown Oakland Senior Center, and there's noise in the background. Someone has a radio going, or maybe the dancers have a band going, or something's happening in the building, and someone comes up with a hearing loss and has trouble hearing. the solution might be to go to a quieter location to have the conversation, unless you can stop the noise. And sometimes you can't. So then that's when you would hopefully be able to go to a different, quieter location. So noise is, like I said, is never a friend. So try to get rid of noise. And if someone has a communication disorder, you want to be proactive, right? And we'll talk about that in a minute, what you can do with noise. Okay, so let's talk first about hearing loss, since that's probably the most common disorder that can cause a communication or a language barrier. So when someone has difficulty hearing, here are some of the techniques that you can use to help hearing and then the person understanding and for having communication. That quiet environment, talk in a quiet environment and try to remove all auditory distractions. Now, that's not always possible, but it's usually possible to do a few things. Like when I'm talking to someone who has aphasia, the disorder that I work with, oftentimes, even like on a Zoom call, they'll have their television going in the background. And one of the first things I'll do is say, can you turn the TV off? Because it makes it very challenging to have a conversation with anyone, but especially with someone who has a communication disorder when there's a noisy background. So think about, just assess, take a look around the background, you know, the environment that you're in with that person and try to make it quieter. What can you do? You can turn off the radio, you can turn off, you know, the television. If people are having other conversations, maybe you're in a cafeteria and there are a lot of people talking, or you're in some other environment, move to a quieter area to try to have that conversation. You can increase your own volume if you know someone has a hearing loss, but that's challenging because if you try to increase your volume too much, it can actually kind of make it harder for them. So you can move a little closer though. So I don't know, in a pandemic, these are all a little harder solutions because we're trying to stay distance from people. But if you're trying to yell across your house, so if you're in one room of the house and the person with a hearing loss is in the other room of the house, that's not a good situation. So even you want to get closer in proximity. Doesn't have to be face to face real tight, but within the same room, within visual distance, because when people have a hearing loss, it actually helps them quite a bit to be able to see the other person's face. So if you're trying to have a conversation with someone and you're behind them or they're in a different room, you've taken away some really good information that's going to help them communicate and help you communicate with them. So get in the same room, turn off the noises as much as you can. And here's a good one. If either you or they are wearing a hearing aid, make sure the battery is working correctly. So I don't know how many times, and hearing aids are very common and they're can be very helpful, but they are not helpful if your battery in the hearing aid is dead. And so you want to, usually when you get a hearing aid, you're taught or trained how to assess the battery. And so you want to make sure you have working batteries in the hearing aid of the person you're talking to or your own hearing aid. Otherwise, you're blocking out the noise and you're blocking the signal. You're making it worse if the hearing aid isn't working. You kind of basically put an earplug in your ear. So, you know, really make sure your battery is functional and make sure their batteries are functional. Don't assume that just because they have it in their ear that it's working. If you're having trouble communicating, right? That's something to look at. The other thing for someone with a hearing loss, so now I'm assuming that this is someone that speaks the same language as you and the barrier is really the hearing loss. You may be able to, and maybe it's noisy and you can't stop the noise and you can't move to a quieter place and their hearing aid is working. You've taken care of all those things. Here you have a pad of paper and a pen because someone with a hearing loss is probably going to be able to understand what you've written to them. And so writing is a workaround. It's a way that you could write a sentence, you could write a question, they could write their response. So, you know, when we're working with people with communication disorders, we have our pads and our pens handy and keep them in rooms. If you're living with someone or you have a friend who may have a very severe hearing loss and maybe hearing aid doesn't really help, then you want to have a pad of paper and a pen kind of nearby all the time. And there probably are other suggestions, and maybe when we get to some question and answer time at the end, you guys can give me some suggestions of things that have worked for you, or we can help problem solve some of these. So that's kind of hearing loss, basically quiet environment, get into the same room, get fairly close, make sure the battery is working on the hearing aid, have a pen and paper ready to write down information. So those would be my suggestions. All right, so let's go on to another challenge potentially that can cause a language barrier. So sometimes someone may have speech that's hard for you to understand. So they may have a speech disorder. There's lots of reasons that someone can have a speech disorder. It's not a language disorder. I'm going to make this distinction. It's that their muscles, their musculature, their coordination of their muscles aren't working quite right for whatever reason, probably some type of damage that they've had. And so when they speak, it's not very clear. It may not be intelligible. It may not quite make sense. And so you want to be able to figure out a way that you can communicate with this person, even though their speech may be hard to understand. So here are some suggestions I have when someone has difficult to understand speech. Okay, so again, here's the number one suggestion: get into a quiet environment. Because when you're trying to talk with someone who's having difficult to understand speech, if there's noise in the background, that makes it harder for both of you. So that's always going to be my go-to, kind of the very first thing I'm going to try. Get into a quieter environment and see if you can understand more. The person can understand you very well. So if they have a speech disorder and nothing else is really happening with them, you don't need to change the volume of your speech back to them. And it's amazing how as human beings, we don't always think that through. And so it's just kind of an automatic thing. We start almost yelling at people sometimes when we don't understand them. And it's something that we want to think about. You don't have to change what you're doing. You want to figure out workarounds so that their speech is more understandable. If the person is very hard to understand, and that can happen, some disorders might be something like Parkinson's disease can cause a speech disorder, or cerebral palsy, or different, it could be from when they're very young or at birth. It could be something that they acquire. You could ask them, is there another way for you to communicate? They might be able to write. They might be able to use another type of communication device to let you know what they want to say. And, you could ask that of them. It may not be possible for them, but that is something that you could try. The other thing that usually helps someone that has trouble speaking, or their speech is hard to understand, is if they talk more slowly, that helps them. And hopefully that's something that they realize. And you might say, you want to be respectful about it, but you might say, can you say that a little more slowly? I'm having difficulty understanding. That would be, I think, acceptable to them. And there may be some other suggestions that we'll have at the question and answer time. Okay, so that's when their speech is hard to understand. Okay, so now I'm going to jump into aphasia, which is something that I've been doing for almost an area that I've been working in and with and doing some research with for about 40 years now, a long time. And it's a disorder that happens because of damage to the brain for a variety of different reasons, but it's a language loss. So that last slide was about speech. It was about the muscles and maybe the coordination being a problem, like we might see with Parkinson's. But with aphasia, it's actually a level of language. So it isn't that the muscles aren't working properly. It's that reading and writing and auditory comprehension and speaking have been affected because an area of the brain that is responsible for language, and those areas of language have been affected, and that can lead to a language barrier. So aphasia causes that language barrier by affecting all areas of language, but here's the caveat, to differing degrees. And no two people are alike who have aphasia. So it is going to affect speaking and understanding and reading and writing, but not intelligence. Okay, that's super important, and people with aphasia would want you to know that. And for different, depending on, let's say it's a stroke in the brain, depending on where the damage is, it may be more a speaking problem and less of a reading problem, or one of those other combinations we could come up with. So it's pretty complicated. It's caused usually by a stroke. That would be the most common cause of aphasia. And here's the thing, it's not rare. About 1/3 of all stroke survivors are estimated to have aphasia. So that's a lot of people. The last statistic I saw was there are about 800,000 people in the United States who have strokes every year. And if you figure that 1/3 of them are left with some amount of aphasia, that's a lot. That's like 200,000 plus that are having aphasia every year, and that's adding to the numbers. So not only stroke, though, you can get aphasia with other brain damage, such as a brain tumor that's growing in the language area of the brain, a traumatic brain injury, a gunshot wound. I bet a lot of you, probably one of the most famous people living with aphasia is Gabby Giffords, former Representative Gabby Giffords. And she acquired her aphasia, unfortunately, by a gunshot wound to the head. And what's remarkable about Gabby is she's a great example of how someone with aphasia can continue living their life and pursuing ideas and positions that are meaningful to them. And she hasn't allowed aphasia to stand in her way. And she's still working with a speech therapist, actually, on her aphasia. The most recent famous person who there was a lot of media attention about aphasia was Bruce Willis. So some of you may have been reading the news or hearing the news about the family announcing that Bruce Willis has aphasia. We don't know why the family hasn't released that piece of the information. It doesn't appear to be a stroke, and then we know it's not a gunshot wound. It may be a more progressive type of aphasia, but we don't know that. But he has done more, and he and his family have done more to raise awareness of aphasia than any other individual ever, I believe. So the awareness of aphasia is much more now after his announcement, the family's announcement. So aphasia comes in different types and severities. I mentioned that before. I also said that no two people are exactly alike who have it. And most people with aphasia have had damage to the left side of their brain. And the way the body is organized, that results in weakness, or can result in weakness, on the right side of the body. So they've had the stroke over here on the left, and the way that the circuits and the connections are in the brain, it can lead to a right-sided paralysis or weakness, but not always. It depends on where in the brain they've had their stroke. You don't always get a paralysis with a stroke. So as I mentioned, aphasia does not affect intelligence or memory. It is not dementia. The typical aphasia is not a dementia. There's an exception to that in a rare case where there is a type of dementia that has aphasia, but for the most part, they are not the same thing. And aphasia, as I mentioned, doesn't affect muscle strength or coordination of the mouth. It's not a speech problem. It's a language problem. All right, so there are about at least 2 million people in the US that have aphasia, and that's twice as many as we had thought in the past. And when we started doing more, looking at the statistics more carefully. And today is June 30th when we're filming this, and June is, the last day of June today, National Aphasia Awareness Month. And so part of the mission of the Aphasia Center of California is to raise awareness of aphasia. And that's one reason why we wanted to do this talk today, to get the awareness with all of you. And hopefully you can help other people that you know learn more about aphasia too. And our website again, aphasiacenter.org. So let's talk about aphasia a little more, because if you understand how to communicate with someone with aphasia, you can almost figure out, I think, how to communicate with just about anyone. So thinking about your day today or yesterday, think about what percentage of the day did you speak to someone, listen to someone or something, read something, or write something. If you're still working out in the workforce, that's probably like during your waking hours, that's probably 90% of your day that you're either speaking or you're listening or you're reading or you're writing. And even if you're retired, I mean, we're doing that more and more. We're texting everyone, we're listening to things on our devices, we're watching things, we're reading online. So it really impacts, aphasia really impacts your entire life if you couldn't do those things. And other communication disorders do as well, but I think aphasia kind of cuts through a lot of them. So let's talk about some communication techniques if you meet someone with aphasia or anyone who knows more than they can say. And that could be a lot of different situations, as we've talked about. So aphasia is similar to your native language suddenly becoming a foreign language. And what I mean by that is that stroke, it happens suddenly, if it's a stroke survivor, into the language areas of the brain in that case. And all of a sudden, you were proficient at English, but all of a sudden now with those language areas being damaged, you're having trouble talking, understanding, reading, and writing in an instant. And so you need to figure out ways to get around that. So as I said, the techniques we'll discuss can help anyone who knows more than they can say. That means intelligence is not affected. You know what you want to say. You're still a competent individual, but your competency is masked. M-A-S-K-E-D, masked by, in this case, this language disorder, aphasia. And so that could include someone who knows more than they can say, could include some people who speak English as a second language. It could, like when you go traveling to another country, it could be you in a foreign country trying to speak that language. And also some people who have dementia, developmental disorders, traumatic brain injury, someone with autism, anyone who knows more than they can say could be, some of these techniques could be very helpful. So keep these in mind. All right, so let's use that foreign country. If you have been in a foreign country, or if you've spoken with someone who speaks a different language, how do you communicate with them? And these are some of the things you might do. So think about last time you were in a situation where you were having a conversation with someone who spoke a different language. How did you communicate? Okay, so there's 4 basic steps overall, and then we'll get to the nitty gritty. So you always want to treat the person respectfully. It should go without saying, but I kind of mentioned before how sometimes we have these automatic behaviors that come out when we're not communicating well with someone else. We might accidentally raise our voices, even if they don't have a hearing loss. We might start to speak to them like they are a child or a pet. We kind of get into that sing-songing, oh, now what would you like to, that kind of voice. You want to really be aware that that's a tendency that can happen without you really meaning to do it, and you need to check against it. You also want to make sure the person knows that you realize that they're intelligent. You're talking about adults here. So you want to figure out ways to send that information effectively. We're back to the beginning, right? Sending a message, receiving the message effectively, and verifying the information. Making sure that you did have communication. Okay, so let's talk about ways to treat that person respectfully. You want to speak naturally with normal loudness. So we're not talking about the hearing loss now, right? So this is a person who's having trouble communicating because of a language disorder, and you want to maintain an adult tone of voice. That is really important. I bet we've all been in situations where we've seen, sometimes that might be a waitress at a restaurant, sometimes that might be an aide in a nursing home who gets into that kind of childish sing-songy voice. That is not treating someone respectfully, I have to say. So really check against that, because that could be something you slip into without meaning to, and you want to get out of that. You also want to acknowledge the other person's frustrations and fears of being thought of as stupid. So if they're having trouble communicating, if the two of you are having trouble communicating, you might say something like, I know that you know, like, I know that you know what you want to say. Acknowledging that can be very important so that the person realizes, okay, they realize that I'm not, unintelligent. Okay, so sending information, what are some strategies? What are some ways? You want, so you're speaking naturally, but you're going to think about using shorter, simpler sentences with a little more expression in your voice, not the sing-songy, but kind of just simplifying things. Try not to use really complicated vocabulary. Trying to put some pauses in your speech. So I'm not going to raise my voice. I'm not going to make it sing-songy, but I might say, John, how are you feeling today? Something like that. And what I would probably also do, and which we'll talk about, is I might supplement, I might write some keywords as well. Or if it was something I was asking that I could draw a picture, I might do that as well. As you are talking, so you want to use some gestures that the person can easily understand. And I'm not talking about sign language, American Sign Language. I'm talking about just normal gestures. So if someone has severe aphasia and I'm curious if they're thirsty, I might say, you know, Mary, are you thirsty? And I'm just going to pair a simple gesture so that she's getting more information, because it's a language barrier, and this is not a gesture, you're working around that language barrier. I might be writing keywords. So in using the same example, if I'm wondering if, let's make sure I can spell it correctly, if Mary is thirsty, I don't know if you're going to be able to see, it's so small, but I wrote the word thirsty there with a pen in block letters. So, and I would say it at the same time. I would say, Mary, are you thirsty? And giving her, again, another way. So maybe the gesture works for Mary, maybe writing the word works for Mary. That's where you have to get creative and kind of do a little trial and error. And then there would be pictures or photographs. And so since we all have smartphones, or most of us do, right? Here's my smartphone right here. I might be able, let's say it's a more complicated thing I want to communicate about. I'm going to use Google and I'm going to search for images sometimes for someone that I'm communicating with, because I want them to really understand. And you show them a photograph, that comprehension is going to go way up. So when we're on Zoom and we're doing aphasia center groups right now, we share our screen and we're using Google all the time to show images. So here's an example of some pictographs. So this isn't using the internet, but these are some pictographs, pictures, drawings, black and white line drawings, I guess, that maybe you're a social worker and you want to find out about someone if they're having trouble, you know, if they need help with taking a shower, taking a bath, or shaving. You can show these things and then say them. They're written down, they have the picture. It's a way of asking a question. These are just examples, but you can see how you might be able to use different pictographs to get at even more complicated things. Maybe if you're a paramedic, you need to find out how long someone, or a physician or a nurse, or maybe you're at the downtown Oakland Senior Center and someone's starting to have heart palpitations and you want to find out how long that's been going on. If there's a language barrier, you might be able to find out by talking through. Has it been really short, just a minute? Has it been for days? So you can see how you can visually communicate something. Maybe there's a problem in a relationship and you maybe someone you're worried is in an abusive situation, and you can get at some of these things that are again, pictured. So we're trying to work around the language barrier. We're using words, we're using keywords. We're not writing out like entire long sentences, but some keywords can be really helpful. Services, again, a way of finding out if someone needs help with something. We could create ways of showing them pictures of something. These, again, examples. So that's sending the information. Now, how about receiving and replying with information? So for someone that has aphasia or a language disorder similar to that, that knows more than they can say, a lot of times asking a yes or no question is really a way to make it easier for them to respond. Most people can respond to yes and no questions. Sometimes with a very severe language disorder, that's even difficult. But we're going to assume for this purpose that they can. I'll show you something that'll help with that in a minute. You want to ask one thing at a time. You don't want to say, Oh, Donna, how have you been doing? Did the delivery happen yesterday? Is the refrigerator working okay? And all of a sudden now you've asked 3 questions in a row. That makes it really complicated for people. You want to ask one yes, no question at a time if that seems like a good strategy for that situation. You might want to remind the person in again, a respectful way, ask the person to give you clues like, Jim, I know you're having trouble telling me. Is there another way? Could you show me or point for me or maybe write part of the word and see if they take the pad from you, see if they will start gesturing. Sometimes people just need a little reminder that there's another way. Here's another thing that's almost always helpful. Give that person extra time to respond. When people have had some type of brain injury, especially, the brain takes just longer to understand what that incoming message is and takes longer to process and to plan for that outgoing message. And so extra time is always good. Those are probably the quiet environment and the extra time. Those are like, keep those in your back pocket. Those are going to be helpful almost all the time. So here's some examples. Here's a yes, no card. And if someone's having trouble in an aphasia group, or we're talking with someone with aphasia, that's something that we would have maybe laminated, and they could point also. So they don't have to say yes or no. They could point to yes or no. They could put a thumb up or a thumb down. And sometimes the answer might be a question, like sometimes it's not yes or no. It's like, well, they want to tell you it's in between. A number line, you can use a number line for so many things. We use this type of thing, again, a laminated 1 to 10. You could find out how someone's feeling. You could find out if they like the food. Do they like their new aid that's helping them out? You can, what did you think of the movie? I set an alarm so that I know that how much time I have left there. So you heard that in the background. My phone is communicating with me right now. You could find out how they're feeling by showing them pictures of different feelings, if someone's sad or angry or depressed. And then you want to verify. So for someone that really has a more serious language disorder, you want to make sure that they have understood. And a way to do that is to summarize slowly and clearly what you think the person's trying to say. So let me make sure I understand. Are you saying, the refrigerator was delivered, and I'm probably going to write refrigerator and delivered, and I'm going to check it out, and I'm going to wait for them to either point to the yes or do the yes or tell me no. Okay, give them extra time. I'm going to add those gestures and keywords if necessary. All right. So now that we know about aphasia and what works with them, pretty much everything else can map onto that. So English as a second language, I mentioned, can lead to a language barrier. Not always. Some people are proficient in tons of languages, many more than I am. I'm good if I can get English out most of the time. So when someone has difficulty using language due to English as their second language, these strategies can help. First off, if someone really is speaking another language than you, and it's something, especially when it's important, best to use an interpreter. Especially if it's anything that is involved with healthcare or finances or whatever. Those are important things, and I don't think what I'm showing you is not the adequate workaround. Best to get an interpreter that speaks both languages to make sure that person is communicating what their wishes are. But then if it's not such a serious thing, consider the strategies that we just talked about, because those should work. Then here's lots of things in here. Dementia, TBI stands for traumatic brain injury, developmental delay. I've kind of put them all together because they can lead to a language barrier. They don't always, especially if it's early in dementia, or it could be a milder traumatic brain injury, or there's different ranges of developmental delay. We could put someone on the autism spectrum in here as well. When someone has difficulty using language due to any of these, which are more widespread brain issues, there are some techniques that we can use, and it really depends on the severity. In this case of dementia, early onset dementia or milder dementia, we might not have to use any of these. Speech might be a really effective strategy, but as time goes on, that may change, and some of the things we talked about with aphasia may come into play. So consider those strategies used with aphasia. Okay, and so I'm almost done and we can open for some other questions. I just wanted to end with a photograph. This is actually right at the flagpole at the downtown Oakland Senior Center. And if this had been a normal June, for the last couple of Junes, we would be having our walk to talk on the weekend. And these are some of the people that are affiliated with the Aphasia Center of California. This was from 2019. That was the last time we had our walk to talk. We're hoping by next year we're back. And people really, they all want you to know, and their families, how important awareness is about aphasia. And so just ending with, we were the first independent aphasia center founded in the United States. We were founded in 1996. We actually started doing some research that led to the Aphasia Center in the downtown Oakland Senior Center in 1994. We're a not-for-profit 501c3 charitable organization, and our mission is to enhance communication skills, quality of life, and overall well-being for all those affected by aphasia. And I'll open it up for questions. Here's some contact information. I'm happy to follow up. There's our phone number. The Downtown Oakland Senior Center also knows how to get a hold of us if people have questions as they're watching this recording, but the best way is to call our number 510-336-0112. And with that, I think I will stop my share and we can see what questions there are. So thank you for your attention. Covered a lot of stuff.
All right, Larry, I see you have a question. I've allowed you to talk. You can go ahead and unmute yourself. Perfect.
Yes, thank you. For a number of years, I have volunteered with a program at UC Berkeley on English conversation with visiting scholars, students. Some have real limited English conversation skills, yet culturally they agree with everything, so that they're reacting almost as an insult if they don't understand what I'm saying to them.
Yeah.
Some have run into problems, traffic accidents, encounters with police, with the courts, and they're embarrassed and don't want to go to an interpreter. They turn toward me because of an established relationship as a friend. And yet they're not really understanding me, and I can tell that. But, trying to help them through different steps.
Yeah, I think the
Any suggestions?
I think the cultural barriers, I didn't even address the cultural piece of it, right? We talked more about the language, and a little of that is outside, I guess, of my pay grade. But what I would, as a speech language pathologist, we don't often get into some of the cultural things, but I've experienced that myself. I did some talks one time in Japan, and my host had to tell the audience, it's normal, it is culturally appropriate for you to ask questions. And Dr. Ellman will not be insulted if you ask her questions. She knows that it isn't because she didn't do a good job. So I think so maybe setting the expectations, and then I don't know if there's a way, if you're finding this being maybe a common, it sounds like it's more than just one person. I wonder if there are some type of education or training around some of the cultural issues of being in this culture in the United States and what the expectations are, and that it isn't insulting. But again, this is not my area of expertise, I'm afraid. You probably have more experience with this than I do.
I'm not sure, but thank you.
Yeah, thank you for your question.
And Deborah?
Hi, thank you so much for this talk. It's been very helpful.
Good.
I have a good friend who has had a tracheotomy, and her speech is very unclear, coming out of whatever the device is that she has. And I and her other friends, we've talked about it. We all have difficulty understanding her. Do you think it would be helpful for us to try to set up those laminated card ideas, with like a degrees from 0 to 10, yes, no, things like that, and ask her about using them? Would that be appropriate to ask her, or is there some other suggestion you
Well,
can?
let me ask you a couple questions, quick questions. I don't want to do a diagnosis via the recording, but what caused her tracheotomy? Did she have some type of brain injury?
She had throat cancer.
Okay, so she's a laryngectomy.
I assume so. I don't really.
Okay.
That sounds right.
Yeah. So assuming if that's correct, if they had to remove her larynx, or more commonly, I guess, known as the voice box, and now she's breathing out of her tracheotomy because they've rerouted some anatomy, then her language, there shouldn't be any language disorder. It's actually a voice disorder in this case, because she can't get air. There's not a larynx anymore to vibrate vocal cords. There's usually, I would hope that I don't know how long ago her tracheotomy or laryngectomy was. Is this years? Is this recent?
No, it's been years. She's
Okay.
tried different devices, but it's very unclear.
So it may be that it's time for her, if she's willing or interested, to get another evaluation with a speech language pathologist who specializes in voice disorders and laryngectomy. There are various different devices. It sounds like she's had some, but there's always new improvements that are being made in devices. The workaround, though, she wouldn't need necessarily a picture, because I would assume she can write. And that would actually be at a higher level. She can convey more information with writing than having to point to pictures. So it may be that having, she's willing, to have the discussion. I'm thinking that by getting the evaluation done, you get a professional involved and who might be able to figure out some ways to go around that barrier for her friends and family, more effective ways. It may be that she has given a device that she can do more typing on if there isn't a better solution for a device that actually, there are like implants that go into the tracheotomy that help with the airflow and the voicing. There's also different devices that you can hold to your neck, but each person is different. So having that reevaluation might be a way to get a nice program set up for her, and especially if she's able to tell the professional that it's been difficult for her to communicate with her friends and socially it's isolating her.
Okay.
But a pad and pen are going to, unless she's having some type of motor problem with her hand, which shouldn't be just from, that's why I asked you about a brain injury, or typing out something. I mean, she's understanding you, so you don't have to do that. It's more her response to you. So maybe look at writing as a good alternative.
Okay, thank you. Yeah, she does write on her phone sometimes. Thank you.
Yeah, good luck.
Okay.
All right, are there any additional questions? Once again, if you're on Zoom, you can tap your screen, and at the bottom, or if you're on a computer, you can wiggle your mouse and you'll see it at the bottom where it says raise hand, and it'll show us that you want to talk. All right, we got one from Paula Shadle.
Hi, Roberta.
Hi,
thank
Paula.
you so much for this talk. It's wonderful. I just wanted to echo what you said about foreign language problems. I lived in Europe for a while, and I found that Europeans were much more understanding than Americans of the fact that you don't speak the language, but you are an intelligent person. And we did what we called hand and foot language, a lot of gesturing. Mm-hmm. And it works, but you have to be able to let go of it. I find that it's most difficult over the phone. When you don't have the personal contact, people tend to repeat louder and with exactly the same words, which doesn't help if you don't understand what that noun or verb is. Yeah. So just wanted to share that. Thank you.
Yeah, no, and I think, Paula, that's a good point. The pandemic, I think, has given us some other options that will continue on in something like Zoom, where although we're in webinar mode and I can't see you, you can see me, but FaceTime or other ways to have conversations where you're able to see one another has really made it easier, because then you can use gestures and a pad or annotate. And I would think that would be helpful for, you know, lots of folks with communication disorders. But I think you're right. Europeans, there are lots of countries and lots of languages around all those borders, and they're much more used to being in a situation where there is a language barrier than we are.
Although Oakland is certainly getting there.
Yeah, no, I mean, it isn't that we don't come across people all the time.
Right.
And I think the intelligence, I think if there was one thing that the people at the Aphasia Center of California, our members, would want people to know is don't conflate or don't equalize that lack of language is lack of intelligence. And I think that's the biggest frustration they have, because when they're trying to communicate and it doesn't come out smoothly or clearly, or it takes multiple attempts, people that don't know, and it's just ignorance, right? They haven't heard the word, or they don't know what the problem is. They assume that that person isn't capable, and then they start talking to the family member, or they give up or whatever. So be persistent, be respectful. I'm sure the people that are in the audience right now and watching later are doing all of that, but I think those are good hints for any of us, I think. But thank you.
Thanks.
Well, great. That looks like it's all of our questions for now. If anyone does have a last minute one, feel free to, raise your hand. Dr. Roberta, I just want to thank you so much for coming. It's been such a pleasure to have you, and I really enjoyed getting all this information from you.
Oh, thanks for the invitation, Jesse. And Downtown Oakland Senior Center has a big place in our hearts. So we're looking forward to getting back in programs there in person.
We're looking forward to having you back.
Thanks for the invite.
Absolutely. I'm going to go ahead and share my screen one more time. I just want to make sure everyone has these upcoming dates. It's a great idea to take a picture of them. We have on July 8th, normal brain aging and abnormal brain aging. This one will be in person and on Zoom. On July 12th, we'll have how to age in place, hiring and working with a caregiver. On July 15th, we have what is AD and neurodegenerative disease. So that is the end of our presentation today. Thank you everyone for tuning in. Thank you to Dr. Roberta Ellman and the Aphasia Center of California for being in our building, for being with us today and sharing all this information with us. Thank you everyone, and have a great day.